All about your skin. Skin is the largest organ of the human body, performing a range of important functions. The integumentary system, or your skin, comprises 3 layers: the epidermis, the dermis, and the subcutaneous tissue. The epidermis is the outermost layer of the skin and is responsible for protecting the body from external damage, such as UV radiation and bacteria. It is also responsible for regulating body temperature and producing vitamin D. The dermis is the layer beneath the epidermis and contains a range of structures, including hair follicles, sweat glands, and blood vessels. It is responsible for providing structural support to the skin and also plays a role in regulating body temperature. The subcutaneous tissue is the deepest layer of the skin and is made up of fat and connective tissue. It helps to insulate the body and provides a cushioning effect. The skin also plays an important role in the immune system, as it acts as a physical barrier against infections and helps to prevent the entry of harmful chemicals and pathogens into the body. Additionally, the skin is sensitive to touch, temperature, and pressure, allowing us to sense our environment and the world around us. Maintaining healthy skin is pertinent for overall health and well-being. This can be achieved through various practices, including protecting the skin from UV radiation, avoiding smoking and excessive alcohol consumption, a healthy diet, and an exercise routine. Additionally, regular cleansing and moisturizing can help to keep the skin looking and feeling healthy. However, it is important to still inspect and verify the chemicals and products being used in your skin routine for harmful chemicals and other byproducts that can have toxic effects on humans. Nanoparticles are being a more understood element and constantly being used in skincare items. As many may say, it is necessary for the product. Many nanoparticles are used for cosmetic looks versus its ability to provide skincare. Always do your research for what is best for your skin. Not well advertised. Firefighters are also a high-risk population for skin disorders due to their high exposure to harmful chemicals and pollutants during battles with fires and emergency situations. Now that you know more about skin, let's talk a bit about sunburns. When the skin is overexposed to the ultraviolet, UV, rays of the sun, sunburns develop. A skin inflammatory reaction occurs when the skin is subjected to excessive UV radiation, damaging skin cells. Sunburn symptoms might include redness, discomfort, swelling, and blisters. They frequently manifest within a few hours after exposure. Here are some crucial details about sunburns. Sunburn severity. Sunburns can vary in intensity from light to severe. In contrast to severe sunburns, which can result in blistering, peeling, fever, and even chills, mild sunburns may only cause little redness and discomfort. Risk factors. Sunburns can happen to anyone, but some people are more susceptible than others. Sunburns are more likely to occur in those with fair skin, light-colored hair, and blue or green eyes. A larger risk applies to people who spend a lot of time outside, particularly between the hours of 10 a.m. and 4 p.m. Prevention. Limiting your exposure to the sun, especially during peak hours, is the greatest approach to avoid being sunburned. Use sunscreen with an SPF of at least 30 and wear protective clothing such as caps and long-sleeve shirts. When swimming or perspiring, reapply sunscreen every 2 hours or more frequently. Treatment. There are a few things you may do to relieve the symptoms of sunburn. Use a moisturizing lotion to help stop peeling and take a cool bath or shower to calm the skin. Ibuprofen or acetaminophen, 2 over-the-counter painkillers, can aid with pain and swelling. Long-term effects. Sunburns can have long-term effects on the skin, such as premature aging and an increased risk of skin cancer. It is important to take sun protection seriously to avoid these negative consequences. This is very important to lowering your risk of melanoma, a type of skin cancer. The skin is very important to our bodies, so please take care of yourself. Thank you for watching. Please consider subscribing. Thanks for watching.